Hi again, I'm Dr. Jeffrey DeSarbo, and I am welcoming you to the last episode of this NeuroSeries, episode 14 on the family support system. And again, I'm really appreciate anyone who's turned in to watch any of this, and I hope I've been able to give you some interesting information. Hopefully you can tell it's something I've been kind of winging as I talk. I always say I never try to be a perfectionist in what I do because I never want my patients to try to be perfectionists. But I do hope that I am trying to reach people out there on a level that they are finding interesting, and especially this unique way of looking at eating disorders. And while I'm usually giving lectures on the neuroscience of eating disorders in my clinical practice, I'm usually working with patients and families and loved ones of patients to answer their questions, to help them understand the process that's involved with eating disorders. I use a lot of this information that I've given in the first 13 episodes to help them better understand this process. And I try to help people learn how to contend with the conflicts that occur in the treatment process and the obstacles that have to be overcome. And hopefully I do my best with the families to also help them emotionally through the process as well as my patients. So I felt it necessary to end this NeuroSeries with an episode kind of devoted to family support. It's not as technical or neuroscience-based as the first 13 episodes, but of course this type of approach and treatment is as essential to a successful treatment plan and recovery approach as anything else I've talked about in the prior 13 episodes. But you'll see what I have to say about this as we go along. So being a caregiver is considered to be one of the most stressful situations one can kind of find yourself in. There's a lot of tremendous feelings of responsibility for another human being, often not only for the person you love, but many times for the person you love the most. And watching someone you care about suffer so much is not easy, and it can stir a lot of emotions inside of the person doing the caring, including emotions such as fear, hopelessness, depression, anger, anxiety, overwhelm. It's not only common, it almost comes with the job. So it's natural, but it's also very distressing to be a caregiver. And to make matters more complicated, if you've been watching this NeuroSeries, with an eating disorder, you're often trying to care for someone who's compromised in their own thoughts and emotional regulation. And you're dealing with an eating disorder language that often is very confusing, and it sounds like you have to kind of walk on eggshells. So often a parent or a spouse just wants the eating disorder to be fixed. However, because of the neurobiological processes that are required to kind of heal themselves, it takes time no matter what you do. And interventions for caregivers need to take into account many factors, including the age of the patient. Families can often take a more active role in treatment at home, or do they need, based on the stage of illness, whether to or not to refer to what's called a higher level of care, such as an IOP, an intensive outpatient program, a day program, or a residential treatment center, or sometimes even you have to go to that hospital to kind of get stabilized. And these are some of the tough decisions. The interpersonal dynamics of the family play a big role, and what's the emotional and physical status of the caregiver, of yourself? And what about access to finances? That's one of the main problems that you have with eating disorder treatment. It can be extraordinarily expensive. And even if you have the money or if you have the proper insurance, what available treatment options are given in any geographical area? There's a lot of shortages of professionals and treatment programs. And sometimes even when somebody needs urgent dire care, let's say in a residential center, sometimes there's a waiting list to get into a place. And what do you do in the meantime? So again, it's the intervention of being a caregiver is a tough role, and usually you do want to, have some support through it. So, having a family therapist is often a key factor as a part of the treatment team. You have your medical doctor, maybe your psychiatrist, your therapist, your nutritionist, maybe you're attending a group, but oftentimes being a part of family therapy is a key component for not just the patient and their recovery, but for the family's ability to kind of cope with it and handle the process, which can be full of dramatic ups and downs along the way. And you don't want anybody, patient or family, giving up. Now, this is a study here out of Portugal. So these neuropsych researchers looked at over 430 women between the ages of 18 and 14. And one of the things about being a parent, especially when you're working with a child, adolescent, or teenager, is you do want to be somewhat aware of what messages you send about eating and body shame. And in this study, they found that when you have patients, they recall any restrictive or critical caregiver eating messages at earlier ages. It's linked to body image shame, inflexible eating, disordered eating, and that about 70% of the variance of this disordered eating could be accounted for by the caregiving message that was sent. So women who especially recall more restrictive and critical caregiver eating messages tend to present with more body-focused shame experience, and they adopt that inflexibility with eating rules and eating disorders and behaviors. And with caregiver messages, it can impact maladaptive emotions and strategies such as coping strategies to handle body image distress and to help cope and alter some inflexible eating patterns that may be harmful in the case of an eating disorder. And it's not to blame parents by any means, but it is an example of what we referred to in one of the earlier episodes of this NeuroSeries as an epigenetic factor that can trigger the onset of an eating disorder pathway, especially in those who may be genetically predisposed. So parenting around eating issues in today's world can be focused on the need to be fit and healthy. And many parents even try to model this for their children with all good intentions. I just want my kid to be fit, healthy, happy. The thing is, you don't know how your child is kind of wired, and many children aren't wired in the same fashion as their parent. Who's an adult. The brain has changed. We discussed that in an earlier episode as well. And the health messages and food and eating pressures may be interpreted or even misinterpreted as judgment and failure by somebody who's prone to have an eating disorder way of processing these types of stimuli. So brains develop and wire differently, and a child may not be able to process food and weight issues in a similar manner as the parent is trying to convey. But also, on the other hand, disordered eating and eating disorders in parents may make their child more prone to the development of similar disorders, especially, again, when there's that genetic profile. So I'm just kind of like relaying here. It's that language of ed again that can be tricky. Even if you say, you look good today, that can be misinterpreted as, I guess yesterday you thought I was fat. Or if you don't say it tomorrow, then you don't think I look good. Or it's really important that I look good to you. And the parent may be just saying it, very innocently, just like as a comment to try to make someone feel better, or a stranger even can say those things. But an eating disorder brain hears it differently. So one of the things that's important, again, is kind of like early intervention. I kind of mentioned in our last episode, and perhaps in a few episodes along the way, how when somebody does have some, let's say, red flags for an eating disorder, it's important that they start getting, at least start off with an assessment by a professional who knows how to assess this. And if they require eating disorder treatment, that you find the best professionals you can. But part of that, especially with children and adolescents and teenagers, is it's important to have, to work as a family, like I said, with both a family therapist and sometimes with a parenting group, which can be significantly helpful. And this has been shown more and more as of lately. And because often if the parents haven't dealt or been through similar experiences, they do not understand what's going in the mind of their child who's suffering from this eating disorder. And it's very common that, for me, parents will say things such as, well, how can I help? That's probably one of the biggest questions I'll get early on when I meet a family in the beginning, is that they, I'll talk to them, I'll talk to their loved one. And I always say child, but this can be spouse as well, and a husband or a wife says, yes, I know they're struggling. How can I help? And that's a tricky question because everybody has different things going on. And a lot of times, again, it's that relationship. Sometimes you have to establish first that if you're going to help, why are you helping? The person who has the eating disorder wants to know, why do you want to help? Because, again, that ed language, often the brain is saying, you just want to help so I get off your back, or you just want to fix me tomorrow so I'm not a problem anymore, or you just want me to look a certain way, or you just want me to stop acting a certain way, or you want me to stop being depressed. And again, that's how that brain is working when they have an active eating disorder. But you still have to ask, and oftentimes I'll have, whether it's the child or the spouse in my office, and someone says, well, how can I help? And the answer I have to say is, ask them right there. Like I'll say to someone, how can your mom help when you're feeling this way? How can your dad help? How can, your husband help? How can your wife help? How can your sister help? You have to ask because they're going to set the rules. So it'll be, well, if you see me struggling, if you can just kind of come over and tell me I'm struggling and be a little more patient with me. You can help by not forcing me or punishing me because I'm having a day or you catch me in a behavior. You can help by listening to me. That's probably the most important thing. I always say, as a parent myself, it's very common that we want to just fix things, especially fathers. We want to fix things. Tell us what's wrong, and I'll tell you how to fix it. And and again, that's an issue when we work with our kids with an eating disorder, or if you have a wife and she has an eating disorder. Like I said, it's not just dads; it's parents in general. We don't want to think that our children are suffering, so we want things fixed as quickly as possible, but if you haven't watched the prior episodes, please do so and understand that you can't fix this that quickly. And sometimes you're doing your best with your very best intentions, and it's just not being heard in the head in the same manner as you're trying to project or help out. So one of the best things you can do is just try to listen. And if somebody says, I'm having a really hard time today, you sometimes just have to listen, hear what they're saying, and rather than saying, well, why don't you do this, to say, I notice it looks like you've kind of been in your head. Is there anything I can do? And that's where you're asking. So, going back to, being involved in the treatment process whenever possible, that is highly preferred. In fact, the more outside of the process a family, loved one, spouse is, or if they're actually even excluded intentionally by the patient from being allowed into the process, recovery becomes much more difficult for the patient and for the treatment team members, because everybody has to be on the same page, and parents and loved ones who don't kind of understand why treatment is proceeding in a certain direction, if they're excluded, it's very common to feel like something's not going right, something should be done differently. And unfortunately, sometimes there are these family dynamics where patients don't let, when they're over 18, of course, when they're a minor, they're entitled to be a part of that treatment process. But when they're over 18, they're excluded. But when we talk about children and minors, without a doubt, it's important that family be involved. in this slide here, the Maudsley Hospital, which is a partner with King's College of London, and I actually got a chance to visit there. They've done some incredible, outstanding research in the field of eating disorders. They've really been leaders in the field, especially with their development of testing of family-based therapy, and it's often referred to as the Maudsley approach. And it's a treatment approach where family essentially takes over refeeding under the supervision of clinicians who are trained in this approach, the Maudsley approach. And it's been manualized so families and clinicians can learn how it takes place. And it's especially good for, younger children. There are adult versions of it, but it really started with children's and adolescents, and it has a fairly high research-based success rate compared to other types of therapy approaches that haven't been as studied, especially, again, with children and adolescents. And the results over the years continue to show positive outcomes with family-based treatment. And in another study here, the second one that's listed on the page, it kind of shows that the results that they've done with multifamily-based programs, where you have multiple families are doing family-based treatment, have been showing even more promising results for recovery and treatment. When again, that's the appropriate treatment choice. And families who might be looking to consider this type of approach should, research for a clinician in your area to discuss this type of program, if it's appropriate, and how to go about doing it. So that's just one thing, especially like how a family gets involved on a higher level of the participating in the treatment process. So parents' experiences of health service for treatment of eating disorders is all over the place, to put it mildly. I always reach out to colleagues in other countries, but in the United States, it's very difficult to work and kind of deal with everything between insurance, locating what's the type of program that works best, what style works best. And this leads to a lot of stress, like I said, on the parents, from both a logistical, emotional, and it's the motivational challenges that are faced by parents, spouses, loved ones. It's so hard to do, especially in the beginning, and figure out. It becomes an overwhelming process. I'll never forget this saying that I learned during my residency training by my residency director. He said, "An eating disorder consumes the patient consumes the family." And through the years, that's what I've seen. It's not an intentional thing to happen. It's just that an eating disorder really is such a complex emotional, psychological, and medical issue that there's multifacets of different things taking place. And it's not something that one has a medication to resolve it with or a certain therapy. And in fact, if someone comes to me and they say, "I have this eating disorder, how do I go about treating it, and how long will it take?" I'm this is me. This is not from this study or any other. But what I've seen clinically is if one person can go through treatment and kind of follow all directions and do every single thing they need to do, the quickest I've seen an eating disorder kind of really fall into a true recovery process where let's just say, their thoughts, that question I say, how much do you think about food, weight, body image, calories, exercise, etc., where it's down below 20%, I say that takes at least about a year if everything goes right. Okay. Now, along the ways, it's not always a steady, decrease in symptoms and thoughts and improvements. It's usually a jaggedy pattern of recovery. It's ups and downs along the way. But in a very best case scenario, it's usually about a year, okay? But however, for many people, it can take a lot longer than that. And that's not due to one's lack of effort. It's due to the severity of the condition that they're dealing with, and perhaps due to many of the types of biological and neurobiological issues we've been discussing in this NeuroSeries. So, It's important for everyone to understand that. This was important here, dealing with couples and the dynamics of couples when there's an eating disorder process. And I kind of put it in quotes there from the paper itself. Partners engage in this forge stage cyclical process involving encountering a disruption, becoming a self-informed individual, countering the disruptions, and reclaiming livability. And if you can pull together a team that really wants to work with the couple. Sometimes the person with the eating disorder will have their own therapist, and instead of a family therapist, they'll just be entering the treatment as couples therapy. Not that there may or may not be something going on in the individual relationship, but it's for support. And the more supported a person does feel through the process, generally speaking, the more successful recovery along the way is going to be. Okay, when you have somebody who's not supportive, and there's plenty of patients that'll walk into my office, they don't have hardly any support system, but they do want to get rid of their eating disorder. It is a struggle for them. They struggle because they feel so alone with that process. And sometimes it's their treatment team that becomes their support system. And sometimes that can even backfire in that they feel if they get better, they'll lose their treatment team and the people that support them. So really having anyone who's going through an eating disorder feel supported, not ridiculed, not ashamed by their treatment, but you're trying to understand it, you try to self-educate yourself, and you try to understand the concept of being patient and asking for what another person needs is critical to the process of recovery. Now, I have to put this slide up because it's an issue in many places, especially in the United States. Eating disorders and health insurance. Treatment can be a lot of money. If you're lucky enough to find experienced, trained clinicians who specialize with eating disorders and they accept insurance, that's fantastic. The issue is many people who treat eating disorders, they don't accept insurance, and that's for many reasons. And often it's like working with, like I'll say, a typical nutritionist has a patient come in. They don't have to make phone calls to the physician. They don't have to make phone calls back and forth to the therapist or get involved in finding treatment facilities. Same thing with psychotherapists. They're not just having someone come in and doing weekly therapy. They have to stay in contact with physicians. They have to stay in contact with the nutritionist. They're getting more phone calls outside of the office with families and patients than the typical psychotherapist deals with. So it's kind of more of a time-consuming process when you're working with somebody with an eating disorder. So a lot more attention and care comes, and then that's not compensated by insurance. The other problem is just insurance itself and mental health. Whenever possible, treatment is not fully covered. That's not the objective of an insurance company. It's is to necessarily provide what is needed. It's to provide what is 100% absolutely necessary, and that's another area where the physicians and therapists and treatment providers have to keep fighting and on behalf of the patient to justify treatment coverage. So, I always say if only people had insurance coverage and access to professionals, we could make substantial gains in the recovery process and eliminating eating disorders. But insurance, at least in the United States, tends to be a main problem. So what I often advise families they have to do is they sometimes need to talk to their accountant or financial advisor, see if they need to set up something like a health savings account. Sometimes treatment providers will do single case agreements or out-of-network agreements. Sometimes there are a few organizations that try, for those in underserved populations, can provide scholarships. Some individual treatment providers work on sliding scales. Some treatment centers can sometimes work on a sliding scale. But I have been asked by people. I remember being at a major conference and someone said to me, right in the middle, like, we don't have any insurance at all. We can't afford treatment, but my daughter needs it. What do I do? And I don't know how to answer that question. I'm just being honest because, it's not like you can walk into a clinic and get eating disorder treatment. Now, that doesn't mean if you have no other options, you don't do that. You do. You'll go into a hospital-based clinic or someone that they set you up on a sliding scale, or it's covered by other governmental funding. And if you can get a therapist who doesn't specialize but is willing to try to understand and work with you, that's who you work with. And maybe if they can't handle it, you ask them if there's someone who can. Same thing with physicians. What's important is that you go into a physician who doesn't understand, you have to make sure you give full disclosure and you talk about the eating disorders. Sometimes you have to be the one who educates special concerns you may have, if you notice certain symptoms, or people sometimes might, like with bulimia, have blood in their vomitus, but they don't report that, and it's something that you have to report. Family has to report. So if you can't get the specialist, which I know you've heard me state is really important throughout this NeuroSeries, you still have to do what you do to try to get some treatment, and sometimes I found, and maybe that's even how it happened to me when I was a resident, it was my first introduction to working with people with eating disorders. And I always say I've learned more from them than I've ever learned in medical school or in residency training. So sometimes you get people who do want to work and understand and try to help out, even if they're not specialists. So I'm just going to give you a few 10 things to do, okay, in general, to be aware of and be, kind of conscious of. And this can apply to both the patient and the family. You want to educate yourself. You want to know as much as you can about what an eating disorder is. You can be suffering from an eating disorder. I have had patients come to me and they've had their eating disorder, let's say for a year or so, and I go, what do you know about eating disorders? And they know very little. They just know what's going on in their head, so they know the experience of it. Families, patients, educate yourself. Read as many books as you can. It's kind of, again, that thing. Read as much as you can, but be conscious of who's dispensing that advice. Is there any other motivation for what they're doing? How well trained are they? And maybe does it make sense to you? Again, I said, when possible, find those professionals who specialize, okay? I've stated that enough through this NeuroSeries. I won't expand. Listen to the team you select. If you have people that you're hiring, don't dictate how they should be running the treatment. If you're hiring these people, you've got to trust them. If they're saying you can't be food police, let us handle that. You have to step back from that role. And if you're having trouble doing those things, that's where, even if you let the team know, you might need your own therapist to help you through that process as well. But you get a team, you have to try to trust them and listen to them. Understand expectations. Like I said, this isn't going to get better in a week or a month or 6 months. It can improve, but an eating disorder takes time. It's really healing. Like I said, I think from the very first talk I gave, recovery is restoration of the brain and central nervous system, and that takes time. It's a process. Everyone has to stay focused on their own recovery. Stop the comparing. Don't compare your child or spouse or loved one to someone else and how they handled treatment, how quickly they got through it. Or don't catastrophize, saying, oh my gosh, I know somebody, their loved one has suffered for the last 15 years. Stay focused on your own recovery. Everybody's different. No comparing. Build a pain tolerance. You may remember me presenting that topic in the NeuroSeries on therapy. And this is not just for the patients that, recovery slows down when it gets too painful. It is for the family too. Often that painfulness comes from having difficulty being patient, okay? Or the pain tolerance is I'm watching someone suffer. It's like when somebody comes in, a lot of times let's say they bring their daughter into my office and I'm treating them, and week or two into treatment, they'll often say, I don't know what we should be doing because ever since she started treatment, she's gotten more depressed. She's gotten more anxious. We don't know if this is the right thing. And I have to go through this psychoeducation that if somebody works on treatment, makes it even more distressing in their head because their head is saying, don't do these things, but they're trying to do it. So it's very common in the beginning for depression, anxiety to get worse. And it's not something that I can medicate away. It's that pain that goes with the treatment process itself. That's where the team has to help the patient build that pain tolerance. But the family goes through pain watching their person go into or trying to work towards recovery. Keep an open mind. That means, sometimes there needs to be changes in a treatment plan. Or in my case, as a psychiatrist, sometimes I am recommending a medication to help with something that I think can facilitate the recovery process or break down a barrier to it. Some people say, nope, no medications. Okay, if I have to follow that rule, I try. It just can complicate it. So that's what I mean by keep an open mind. If I need to use something as a tool, or a nutritionist wants to do a different approach, or a physician is saying I think we have to do this in a hospital. It goes back to trusting that team and keeping an open mind, or if you need to go to this treatment center and it's on the other side of the country, sometimes things like that can be difficult. But if you need treatment, you want to go where you have to get it, and you want to kind of do what you have to do for recovery. Learn the language of ed, like I said. You can say, you look good today, and that can be a disastrous saying. I always say to parents, you got to just watch out what you say because it's just heard differently. It's a tricky language. There's some techniques in an office that I'll use to help patients better understand how their loved one is interpreting what they hear. Sometimes I just ask them. It's like I'll say, so when your mom says you look healthy, what do you hear? And the patient says, I hear I look fat, And so you want to learn that language, okay? And again, you're always going to feel like you're walking on eggshells, but if you understand the process, you'll understand which eggshells to walk on. Let the team set meal plans. Okay, that's part of that trusting your team. Try not to be the food police. Again, if we're talking about children and adolescents and you're working with a certain approach, like the Maudsley approach, then the family becomes involved in kind of setting the meals, administering the meals. With other types of treatment, though, if you've got that experienced nutritionist on board, you got to let them do the work, and you can't be food police unless you're. When I said if you ask, someone says, how can I help? And a patient says, I need you to help cook my meals in the morning or or sit with me. Okay, that's when it becomes more acceptable to do those types of things. And the thing that I say you have to do is keep fighting. Okay, it's just like other types of recovery programs. People go into treatment. Maybe they're admitted to a rehab facility 10 times, and it might be the 11th time or it might be the 12th time. I'm not saying that most people go into treatment centers 10 times. They don't. Some do. But you want to keep fighting till you get into a better place. And if I might as well say that, I'll just tell you the 10 things not to do, which is kind of the opposite of what I was kind of saying to do. Don't make any assumptions, okay, about treatment itself or about why a patient has an eating disorder or any assumptions on what you should have expectations for as treatment as far as it being quick and resolving easy. Don't try not to work with inexperienced clinicians unless out of complete necessity, that because you always want to be working with somebody on this. Don't think you know a better way. Again, that's what I had, trust your treatment team. If you hire people and you've got to let them, you got to trust them. Even if you're a clinician yourself and you work in the field of eating disorders, sometimes you think you have a better way, but your way is kind of being projected based on your own personal interactions with the people you're trying to support. And so you should play a role perhaps in family treatment. You can question treatments, say, I need to understand why you're doing this, But if you're going to say, I think it should be done this way, and I've heard that at times, then I'm usually on my end saying, I respect if you want to go in another direction. Here's why I've been doing this. But, it's not that I can change my direction. And most clinicians are going to be that way. Unrealistic expectations, again, they should be doing better by next week. I want this behavior to stop in the next 3 days. They did great for the last month. Now they had this, this behavior, and you start to feel things are falling apart. Again, it's a bumpy road that needs to be understood. Again, don't compare yourself to others. We're telling our patients that all the time. Families have to do the same thing. Everyone's unique. Don't avoid the fear of treatment. There's no way. It's a very scary process. And I always go back to, it's just the more you have with fear, sometimes you need to understand that through your own therapist, and you have to build your own fear tolerance. Set the rules. Don't set rules that interfere with treatment. From a family's point of view, that can be several different things. Even culturally, sometimes there's rules with religious holidays that require fasting. And usually I'm having the patient talk to the member of their clergy or rabbi or anything if a certain holiday is coming up, to see, do they have to follow through with that cultural norm, or are they excused from that because they're under medical treatment that requires them eating? So those things have to always be explored, or it can interfere with treatment. I say don't say the wrong things. By that, you're going to say the wrong things. It's like I said, it's like know the ED language, okay? But the wrong things are, you look like you gained some weight, you look like you lost some weight, you look pretty today, you look better, you look healthier. Sometimes, and again, the wrong things to a person with an eating disorder can be very well intentioned. That's a nice shirt you have on, can somehow get misinterpreted. So it's kind of don't say the wrong things. I'm kind of saying learn the ED language again, and again, try not to be the food police unless it's appropriate, like with a Maudsley approach and children and adolescents. Never give up. Do not give up, okay? I'm just going to come back to this. Do not comment on appearance, okay? Because this is a hard concept. We live in a society that is constantly commenting on appearance. It's like, all the time. Like even in my office, somebody will come in and say, "Oh, Dr. DeSarbo, you look good. You look like you lost some weight." And I have to respond, "Don't worry, I'll find it." It's in many cultures how we respond. The thing is, with an eating disorder head, it's a comment that has such deep meaning. It goes behind the surface compliment that so many of us take it for. So families say, "Well, what do I say?" And I say, well, if someone says, "Mom, Dad, how do I look in this outfit?" You respond to how they're feeling emotionally and be sincere. Well, it looks like you're happy. Are you happy in it? You look like you're not pleased with it. You look like, you might want to say you look great, and you may feel they look great. But when you comment on appearance, it can become a tricky situation in many people. I remember once I had a patient in my office, and I was explaining to a mother this whole concept of you really can't comment on anything, or if she comes out and says, "How do I look in this?" Because it's going to be a lose-lose situation. And my office manager, who's now been with me for years and is so experienced, she was early on working with me, and family walks out, and the first thing she says to my patient is, "I love your shirt." And we were all laughing because I just had that talk about, don't even comment on the shirt, because it's like, if you say, "I love that shirt," and then next time she shows up, you don't say that. For many people, it's like, I guess she doesn't like the shirt. I don't look at that. She didn't make a comment. It's noticed, So appearance is a very tricky subject. Always refer back to emotions and feelings. As I mentioned before, I learned the most probably from my clients who taught me the most about eating disorders, more than I learned in medical school or in my residency training or anything. And I remember this client who said to me this quote. She said, "My dad said, 'Why don't you just eat?' And I said, 'It's like telling someone who's drowning, why don't you just swim?'" And I thought that was a great reply because it's when someone's struggling with an eating disorder, it seems like all they need to do is these very simple things. But to the individual, it's almost impossible. Again, they're frozen with it. And that's something that everyone needs to know. And that's why learn as much as you can about an eating disorder to support the individual, or they feel alone. So, whether it's watch these types of videos, read as many books as you can, talk to the therapist, talk to the doctor, talk to the nutritionist, keep that open mind, listen to what they're saying about an eating disorder so that you understand it. The more you understand it, the more supported your loved one, be it your child, your spouse, or anyone who's close to you struggling with an eating disorder is. The closer they are to you, the more important it is they feel you can understand what they're going from. It's more important they feel you understand it than that you're trying to fix it. So I want to thank everyone here for your interest in learning more about the neurobiology of eating disorders. And again, please share these videos, tell others about them if they want to understand eating disorders from this unique perspective. And also, remember, they're very complex issues. They're very debilitating issues, and they're very life-threatening conditions. And if there's anything I can keep thinking of, I'm going to try to produce some more slides, some more videos, some more talks that I can do. Always remember that we have some courses for clinicians. We periodically will be doing some courses for families and for patients as well. And if you need any type of information about this or anything else, at the end of each slide, you've seen this contact information. We'll also be soon starting our podcast series, thanks to Rob Martin and Rob Martin Studios, which has helped me produce these videos just to get them out to the public. And we're going to have some interesting talks that will continue to be on both the neurobiology, the neuroscience of eating disorders, the most recent research that comes out each month, as well as interviews with people who've been in recovery and people who are really experts in providing treatment services. And if there's anything else, any ideas, please email them to us and we'll look into it.